Hello and welcome to Swaay.Health. I'm Colin Hung and I am here in Nashville, Tennessee for the NextGen User Group Meeting. One of the big announcements here is the closed loop practice and patient experience solution, which gathers up all of NextGen's patient-facing technologies under one umbrella. We caught up with Jenna Hagan to learn more about it. Let's get to it.
Swaay.Health.
Jenna, welcome to the program.
Awesome. Thank you for having me.
This is exciting. We're here at the NextGen User Conference, and I'm looking forward to talking to you about closed loop and some of the stuff you're doing. But before we get there, Jenna, can you tell us a little bit about yourself and your role at NextGen?
Yeah, absolutely. Thank you for having me today. So I'm a director of application specialists here at NextGen Healthcare. I work closely with our product specialist teams, our application specialists, engineers, really helping to enable sales, but also work closely with services and support to help client success.
Now, today we're going to be talking about closed loop, which is around one of my favorite areas to talk about, which is patient experience.
Yeah.
So can you give us a little bit of an idea of what closed loop is?
Yeah, absolutely. So NextGen closed loop patient and practice experience is really the evolution of connecting technologies and workflows to provide efficiency for patients and for providers and practices, enabling technology like patient experience, digital documentation, payment workflows, providing that seamless workflow for an organization through technology.
So with the closed loop system, what's the main goal of it? Like, what are you hoping that the outcomes will be when someone implements it fully?
Yeah, great question. So, it's like when you go to a friend's house, right, or a grandparent's house, you go into the side door, the back door. It's friendly, it's welcoming. You hear the market talk a lot about the digital front door. Well, we really want it to be a welcoming experience for patients into an organization. So it's providing that integrated, secure, seamless, friendly, welcoming technology into an organization. The reality is that patient get access to care a variety of ways. And so being able to enable that, but also let the providers have efficiency and the staff is incredibly important.
So I want to go back to the staff efficiency in a minute.
Yeah.
But what kinds of experiences and what kinds of ways are you talking about in terms of getting a patient in the door?
Yeah, absolutely. So a patient could be reminded that they need to come back in for due care, right? But instead of a staff having to run a report and make that phone call, let's let a system know that they're due and automate out that message for the patient. It could be that a new patient to an organization, like myself, I just moved to a new city. I'm looking for physicians. I'm Googling online primary care physicians. That reputation management is going to make me as a patient want to go see that organization and have access in. It could be that I, as staff, automated messages to say, hey, click here to get scheduled. Or, hey, would you like to be seen sooner and join a wait list? Instead of staff having to make those phone calls, we're enabling technology to let patient have that self-serve access through automation.
Gotcha. So it sounds like it's a combination of outreach and then inbound and managing all that stuff that a patient has to do prior to coming in to seeing the physician.
You got it. Absolutely. You got it. There's nothing worse than being a patient and speaking from experience, showing up, getting a clipboard with 12 pieces of paper to fill out, and then watching the staff scan it. That lengthens my time that I'm gonna actually talk to the provider. And so it really is that closed experience.
So on the physician side, on the provider side, what are some of the efficiencies that you mentioned before? What are some of the benefits for them?
Yeah, absolutely. So as a patient, when I get that automated message, I've got that appointment and I'm filling out paperwork before I come in electronically. That information discreetly comes into the system automatically. So the providers already have, why is the patient here? What's their complaint? What's their past medical history in the EHR? Then the providers get to use NextGen Mobile and our ambient assist technology, and that drives even more efficiency in their engagement with the patient. So it's all getting consumed electronically. It's that closed loop experience and that notes being generated pretty seamlessly with minimal clicks.
So with the closed loop technology, it sounds like these things have been available before in NextGen, and now you're just sort of bringing it all together under one umbrella. Is that right?
Yeah, there's an evolution of parts of it have been there, pieces have been there, enabling co-development with really strategic partners of ours and getting to that true platform approach, specifically to the patient experience, has been incredibly important for NextGen Healthcare. And so that evolution of really connecting in the integration of what we have and working very closely with our preferred partners is how we got to here.
And if you have a message, one message you can give to other NextGen clients who maybe haven't fully implemented this, what would you tell them?
Yeah, absolutely. When we look at the evolution of healthcare, right, you've gone from paper charts to EHR, meaningful use, MIPS, Patient experience is among us. It's the evolution right now. And so really staying ahead of the times, making sure that you're providing those opportunities for patients to have that access in, but self-serve opportunities is incredibly important. We know that organizations and patients need access over 30% of the time after business hours. Most organizations aren't staffing their office 24 hours. And so being able to provide that self-serve access after hours then starts that trickle effect of success and optimization and a really good patient and practice experience.
Jenna, you've shared a lot of great information with us today. Where can people go to learn more about NextGen?
Yeah, absolutely. Thank you for having me today. They can go to nextgen.com, www.nextgen.com, and there's resources in there where they can click through patient experience, provider experience, and check out all of our technology.
Amazing. Jenna, thank you so much for being on the program.
Thank you for having me.
I want to thank Jenna for coming on camera to tell us about Closed Loop. I especially appreciated the walkthrough that she gave on what the patient would see when interacting with their provider through the platform. And hey, if you enjoyed this interview, please mash that like button and click subscribe. Also, head on over to Swaay.Health, that's Swaay with 2 A's, .health, where you'll find more great content like this. I'm Colin Hung here in Nashville, Tennessee for the NextGen User Group Meeting. Thanks for being here, and I'll catch you on the next episode.